how potentially destructive corporate medicine is and big pharma is. So I don't want to bring the coals to Newcastle, but I wanted to kind of concentrate a little bit on how big farm and corporate medicine established the research protocol and essentially the treatment agenda in our country, which is quite different from, not that I've studied or worked in Europe, but it's quite different from any other industrialized nation. And as you know, too, we have the lousiest statistics. We have the highest maternity rate, mortality rate, infant mortality rate, et cetera, et cetera. But just as a way of background for me that I think may be germane to this talk that I'm giving is, I never had a private practice. I was an employee of a hospital when they were a little community hospital and when they became part of a corporate mess.
Would you tell us what you did? Were you a doctor? Were you a nurse? Was it an HMO?
No. It was a hospital that I worked for. I did my residency there, my chief residency, and then AIDS came along.
Oh yeah.
And we got the AIDS grant, the Ryan White grant. So the hospital paid me through the grant. That's how that worked. As part of my job description, not in the early days when AIDS was crazy and I was doing 18 hours a day in the clinic, but as it slowed down a little bit, I was asked to sit on many hospital committees. I don't know if you know that hospital committees need to be, at the time, populated by physicians. The physicians who worked for the hospital were a captive audience because you weren't asked, you were told. A private doc would be somewhat reticent, perhaps, to spend an hour or two a month away from their office, understandably. So I sat on a lot of committees. I sat on credentials committee. I sat on pharmacy and therapeutics. I saw the inside of the beast, I'll call it, not because I wanted to, but because that was part of my job. So and part of that also was teaching. We had a medical residency program in internal medicine. We had medical students, we had nursing students, we had phlebotomists, we had social workers from the mental health field. We had a lot of teaching going on, which made a very rich and nice environment. So that was my background. And today I wanted to just detail about the medical industrial complex, which was first described in my research that I could find by Dwight Eisenhower in the 1950s as being a great deterrent to democracy, actually. And of course, that was repeated by Martin Luther King, Dr. King. Healthcare was always an essential part of our rights as citizens, and healthcare that was not for profit, but for the benefit of the recipients of that health care. And clearly, by name, the definition of the medical industrial complex is corporate. And their mission is to make money. Understandably, that's what a corporation does. It may work for a lot of other things, but it certainly doesn't work for healthcare. And I remember in my first year of residency, Joe G., who died in that first year from treatable lung cancer because he had no insurance, and everybody bullshitted. You know, this doctor, oh, I can't do him because he's got COPD, he's got to go to pulmonologist, he's got to go here, he's got to go there. Yeah, and by the time all that was over, he died. So that was 1985. So this has been going on, and it's So that's where I'm coming from. But I think the insidious thing that may be not so recognized by all is how big pharma sets the research agenda for medicine. The research agenda is driven by pharmacology. So, in other words, I'll use an example. Hormone replacement therapy in women. For 10 years before the Nurses' Health Initiative came out and showed that it was cancer causing in women. That was the pharmaceutical industry was nuts about every woman who should be on hormone replacement therapy, and even those that are 40, because they have mental fog and they have fatigue and they sweat at meetings that they go to and all this kind of. Every woman should be on hormone replacement therapy. So every woman, and the drug companies who have representatives that made more than I did and were more intelligent in their field, in their area of specialties. The training they get from the pharmaceutical companies is unbelievable. Would come to offices, providers' offices, and say, here's a gift certificate to the Bernadette in the city, right? That's what, and here's information about our new antibiotic. Quite literally, that happened. So they had an incredible influence on the providers. There's 3 journals that are probably the most important medical journals that academics, researchers, everybody reads, and that's the New England Journal, the Annals of Internal Medicine, JAMA, and British Medical Journal. If you pick up one of those, and I meant to bring one of those journals, over half of the pages are pharmaceutical ads. Pharmaceutical companies set the research agenda. The pharmaceuticals name it, tame it, and blame it, okay? So let's make a disease up. Let's make up perimenopause. Now, clearly, women have perimenopause and have symptoms and need treatment for that. But not everybody does, okay? So you want to make it a disease, right? You want to make it a problem. Oh, how often do you have mental? How often are you tired? How often don't you sleep? How often does your mind run? How often? Yeah, let's make it a disease. So we name it, we blame it, it's low estrogen, and then we tame it. We give them estrogen. This is not a knock on hormone replacement therapy. This is just to show you a paradigm of how our research frequently is set up by these companies who are looking to find a disease, and once they find it, they treat it with a pill. The Wegovy, the GLP-2, I have read every single study that's been published in major journals. They're excellent. This looks like a wonder drug. I'm an old lady. I've seen wonder drugs before. My parents used to tell me if it's too good to be true, it probably is. I don't know. You're not fat. You don't have heart disease. You don't have diabetes. You don't have cholesterol problems. The studies are wonderful. Kidney disease. It's hard to take, and you just have to be careful because you got to realize how this research agenda is set up. You got to make it, you got to be, when we say in integrated medicine, you got to make it you ill to the pill. We got to make something wrong with you so we can give you a pill to help you. Okay? 2 weeks ago in the New York Times, which is the most important medical journal I think I read, they came out, cardiology, here's another little example. Cardiologist has been telling us for years, cholesterol, cholesterol, cholesterol. You got to know your cholesterol. You got to know your cholesterol. Everybody knows their cholesterol. They don't know their kids, grandkids' names, but they know their cholesterol, right? Then they said, it's not cholesterol. It's really bad cholesterol. Then they said, it's not bad cholesterol. It's the type of plaque that you have. They were an inflammatory plaque. And then there was a plaque when they were doing cardiac caths, they'd take a little piece of the plaque. Oh, there's foamy macrophages, so this is the inflammatory plaque. So in other words, over the years, you sit and watch and you say, what the hell are they talking about? Okay? Is it cholesterol? Well, we knew it wasn't cholesterol a long time ago because you make 90% of the cholesterol in your own body. Your body makes it. So eat all the oysters you want, but you're going to have cholesterol. Then we said, okay, it's the bad cholesterol. Then it's the apolipoproteins. That one for now in the Times, they just had an article. The American Heart Association had their annual meeting, and they said, we got it. It's this new protein that's really the problem. And we have a drug for it. And this came out, I'm not making this stuff up. They came out with a drug, it's a peptide inhibitor type of thing. And this is probably, now we finally got it right. You know, it's the first time you hear this stuff. So you got to understand where our research comes from. And this is where it comes from. It starts in medical schools. I would have the medical students come to the hospital and they have pens and all this kind of crap and mugs and alarm clocks and they're even a laptop from the drug companies, from the medical schools, right? You know, I get it. You're in school. Money is frequently an issue for students. Drug companies, you know, when I was chief resident, I stopped them from bringing lunches to the residents. We used to work 125 hours a week in the first year of residency. That was before the visa line and all that. In any case, they get you every way coming, the drug companies. Providers still maintain a lot of their information from the drug reps that come to the office. Now, this is one way that corporate medicine may be helping, because now if you work for a corporation, you got to see 35 patients a day. So you have maybe a little less time for the drug reps. But they seriously are a very formidable source and are incredibly knowledgeable and know how to get in. They have speakers bureaus. Dr. Regevik, we would like to send you to a meeting about the two new drugs that are coming out for HIV. And it happens to be in a 3-star restaurant, which of course you can tell is my weakness. And the speaker is paid, of course, by the drug company, and may or may not have particular expertise in that area, but the drug companies give you the slide set. They tell you how to do the statistics. I don't know statistics. One guy I knew very well. I don't know how to do statistics. Well, this is how you do it, Doc. You say, this is how you determine the p-value. They tell you, they feed you. It's like a smorgasbord, truly. So, and then they have, they pay physicians and providers at the time that's kind of been cut back a little bit, but they pay for you a lot of money. To me, it was a lot of money. Give you $2,000 to spend a Saturday all day with us. And what they do is they get your ideas and your clinical feedback. Well, I had 3 patients who went into azotemia and got, when they started the D4T, you had 3 patients, and they get data like this. And they have a lot of people that sit around the room thinking, God, 2,000 times 20. And all these provide, you know, this is what we did. I had to have this way of abdicating my own guilt and participating in this. You had to, as an AIDS provider, you had to kind of deal with the devil. You had to dance with the drug companies, because that's what the whole disease was about. It was looking for the new drug, and the first drugs we had were absolutely awful. And they worked, you know, and they now have all, for all intents and purposes, not cured, but AIDS is no longer a fatal disease. I'd rather have AIDS than to HIV positive than to be, you know, diabetic or have bad hypertension or something like that. 2 shots a year. That's all you have to do. You don't have to take a pill every day anymore. So they've done great things. I don't want to completely squash, obviously. Cardiovascular disease, they've done great things. Cancers, a couple childhood cancers that used to be fatal, AML. It's absolutely curable. Absolutely curable with the drugs. So, but you just, I think, need to get how, what their plan is, which is to sell drugs. And even if you only sell them for a few years, you make billions of dollars. There was an NSAID, a drug like Motrin or Naproxen out about 10 years ago, 15 years ago. They put it out, everybody, this was the new drug, blah, 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 it was wonderful, everybody was on it. In 2 years, they found it caused heart attacks, so they stopped it. Yeah, as I get older, I can't, the names.
Yeah, I remember.
I remember the drug.
Because I had the stock, I remember.
Yeah. So that's what, so even if it pans in a year or two, they make tons of money. Tons of money. So that's the evil of that. They also have a corner, when I'm going to talk about the alternative therapies, they have a corner on the research market because they have the bucks. very, very expensive to do clinical trials. Not as expensive as they say. Every drug is $10 million. But it's very expensive to do the trials. And, Euromedica, a very high, very professional nutraceutical company, doesn't have the money to do randomized controlled clinical trials on their hemp and turmeric product. But yet they have anecdotal evidence of its anti-neogenesis, of its anti-cancer patients. David Spiegel, talking of mental health, showed 35 years ago that taking metastatic breast cancer, stage 4 breast cancer, and this was a long time ago, so that was really deadly quick. Now there are chemotherapies that modulate that. Found that women who were put in a support group, and Spiegel just sat in there. He didn't even moderate it. He just let the women talk to each other. Lived 7.5 months longer than the women who weren't in a support group. So mental health, very important. If that was a drug, that would have been put on the market, 7.5 months survival rate, exceeding those that didn't take this drug or didn't sit in this support group. That's amazing. So but who's going to do a research project on that? And then there's the ethics, of if you know it works, how could you not keep people in the study group, et cetera, et cetera. But that's that. Now I'll go into, and by the way, interrupt, ask me to clarify, ask questions. Yeah.
I think it was around 2000 or so. There was, and I don't remember the name of the law. There was some. I used to be the education and training coordinator in inpatient rehab. That was a state-operated facility. And I was told by some of our speakers that they could no longer bring gifts, which I think had been happening before my time.
Detail guys, we're not allowed.
Yeah,
Who could
pharmaceutical reps.
Yes, they've cut down a lot.
I don't remember the law, but it really curtailed a lot of that. But I think that there's still a lot of it going on. But you mentioned speaker's piece.
But, there's a lot of way around that. So we don't have the pens to crap anyway.
Yeah.
We don't have the mugs and the clocks and the stuff like that. But there's a lot of other ways around it. There's the Speakers Bureau. They're not allowed to go above 3-star restaurants now. They can't. So, there's that. And then there's still the focus groups and stuff like that. But yeah, they have cut down a lot.
Well, they weren't allowed to give out samples anymore, the doctors, to give to the patients. But because the drug company, now whether they did it or do it, I don't know.
That's a tricky
that
one because
came when I was still working
yeah,
at the hospital.
because the hospital frequently will have policy on dispensing medications, and when you give samples, you're dispensing a medication, basically. So they like the big corporate that took over my little hospital said absolutely you cannot have samples. The smaller one said it too, but we went around. But absolutely you cannot have samples in some hospitals. So that's a part of it. And they have cut down, and they also have now disclosure rules. So in any of these, in even the smaller journals, if you write an article on the efficacy of peptide T or something in cardiomyopathy, you have to disclose as an author where you've gotten funding from, whether it be studies funding or whatever, or direct payments or whatever. You have to disclose that. So it has improved. There's no question it has improved. And again, they do wonderful things, but it's a corporate model. Both of them are. And of course, PharmD is the biggest lobbyer in the country. So you're at loss. So the other thing, so we call Western medicine allopathic medicine, as opposed to alternative integrative medicine that's practiced in the West, in Europe. And allopathic medicine and most of these things that I'll just mention are innately different in one very, very important way. Allopathic medicine wants to give people diseases or put people in classes of disorders or problems or proclivities. Oh, your mother had multiple myeloma, you're at high risk. They want to put people together. They want to group them together. And they want to treat what ails them. Whereas Ayurvedic medicine, traditional Chinese medicine, homeopathy, functional medicine, which I'll go into a little bit in each one of them, do just the opposite. When I was in residency, it was the gallbladder in room 10, it was the prostate in room 12, it was the disease. We weren't asked to consider the patients, because if one patient A has a gallbladder and patient B has a gallbladder, it's not the same gallbladder, quite literally, physically, but also up here. And we know there's not a mind-body connection, mind and body are one. So it depends upon what kind of person has the disease, more important than what disease the person has. The other thing that allopathic medicine stands by is they're anti-everything. So antibiotic, right? And against bacteria, viruses, mold, stuff like that. Anti-hypertensive, against hypertension. Anti-anginal, anti-everything. They're against, so they're giving you a medicine that takes care of your symptoms.
Antihistamine.
I'm sorry?
Antihistamine.
Antihistamines, anti-everything. And we know that, for example, giving an antibiotic that has efficacy against a certain bug that you have works on a petri dish, doesn't mean it works in each of the patients, because each of the patients are different. Maybe you have a little, biometabolic differences. So every drug is not the same, and every disease is not the same. And this is what is embraced by the alternatives. I was talking to a friend the other day, and she said she had gone to one shrink and didn't bond with him, and then went to another, and she said, the guy talked to me for so long. He asked about my mother. He asked about my childhood. He asked about my father, my brother, my relationship. I said, Mazel tov, who is the guy? I want to go to him, right? Because that's what you need to do. And I think mental health is probably the one field that has kind of recognized that everybody's different. One schizophrenic is not the same as the other schizophrenic. They can be really incredibly different. Whereas we keep saying one gallbladder is a gallbladder. So I think that's important. So traditional Chinese medicine and Ayurvedic, traditional Chinese medicine may or may not include, depending upon where you read, acupuncture and acupressure. Acupuncture can be considered an energy modality because it works probably with electricity, subtle electric fields or whatnot. So some people include traditional Chinese medicine to include acupuncture, and some people say acupuncture is really different because traditional Chinese medicine, like Ayurvedic medicine, really considers the person that has it. So there's all different ways that they go into pulses, tongue readings, all this kind of stuff as to how you're different, how you're unique, and what best way to treat you. As I think you probably know, I think it was James Reston in the early 60s, was working for the Times, and he was in China, and he got appendicitis, and they said, we got to take your appendix out, and they had no anesthesia, except acupuncture. And he had the surgery, and that's what brought, and then Nixon came along. So that's what opened up the East a little bit to people into acupuncture, because he, successfully, there's no better test if acupuncture works than to have your appendix taken out with nothing but that. and they're 4,000 years old. They obviously developed in very different parts of the world, and they had no communication. Ayurvedic in India and traditional Chinese medicine, obviously in China. And they have so many similarities. It's amazing. It's almost as if they must have had an internet to say, we're going to talk about the five types of body personalities. We're going to talk about the diet and which some onions may be great for you, but I shouldn't have them. Type, that kind of stuff. So they're amazingly similar. And the other thing I just want to mention, just to kind of legitimize acupuncture a little bit.
Sorry.
They've been in peer-reviewed journals to prove efficacy for acupuncture for back pain, for a variety of things, but clinically, and actually Medicare covers acupuncture for certain conditions. That's the kicker. You got to know the code. But guess who uses acupuncture extensively? I was shocked at this conference. The military.
Really?
And I thought, the military? I didn't think they were like avant-garde or cutting edge or anything. Well, when you think about it, it makes sense for them, because what do they have to do? They have to have troops that can do the job that they have to do, right? They can't have them under the influence of anything, right? For obvious reasons. And they have to be very efficacious. They can't have side effects. So part of the Afghanistan medical force, and that's when I went to this conference, I can't attest to it now, used ear acupuncture on the battlefield for blood flow and pain, for hemorrhaging and pain. And actually in my bag, I have a little thing here, the homunculus of, this is kind of, I didn't bring this thing. The ear is representative of the entire body. And the Army medics had a whole package of little tiny needles that they would insert in the ear, the pinner and the helix of soldiers to stop hemorrhage and pain. So it's used, and the military only cares about things that work. They don't have to be influenced, but that's a politics. Anyway, the other major form of alternative or integrative medicine that has come out in the last 10 years is functional medicine. Functional medicine is asking ACEs, your parents, your spouse, your kids, your job, your everything. How do you respond to things? How do you integrate things? What makes you tick, kind of, so to speak. Cleveland Clinic, which is, I'm sure you know, was a bastion of academic medicine, and they have adopted the functional medicine model, which is kind of, and the last time I know somebody who was there, last time I checked, they had a 6-month waiting list. When they first opened, they had an 8-month waiting list. Kind of like the Mayo Clinic in terms of its reputation as academic, non-economically interested kind of clinic. But there is a functional medicine clinic in there. There's a functional medicine website. It talks a lot about mind-body interventions. Herb Benson was one of the early people who was a Harvard-trained cardiologist, Harvard-based cardiologist and trained, who described white coat hypertension. So, like, what's going on? They come into my office, I give them the high blood pressure medicines, and they do fine, and then they stroke out in the middle of the night 2 weeks later. And they stroke out because the blood pressure is too low, right? You can have two types of stroke, the bleed or the clot. And they stroke out because their blood pressure is too low, because their blood pressure was falsely high when they went to the doctor's office. Mind, body, I mean, it makes sense to us now. So there's that, which really includes mind, body medicine. And it's I'll say that. The other thing that's up here that I'm mentioning, because of its availability apparently, is osteopathy. Osteopathic schools are the graduates are DOs as opposed to MDs. They're equivalent for all licensing purposes and privilege purposes, but osteopathy has this craniosacral manipulation thing and a whole different paradigm also associated with it, which was not being actively taught for decades in the schools. So they were just MD wannabes, kind of thing. And you could get it, and years ago it was so hard to get into medical school, everybody wanted to be a doctor. So they would go to any place where they could get a medical degree. And the whole field of osteopathy seemed to be going down the drain, which was really unfortunate because there's rich, rich, rich history and literature in that field. The Wright Center in Scranton, and they have satellite clinics. I guess one of their clinics, I think I read it in the River Report. The River Report is my second favorite journal after the Times. They are going to be a training site for the osteopathic residents to do osteopathy on patients. And I believe the clinic that they're doing it in is an FQHC, which is a federally qualified healthcare center. It means they get, what they'll get now, I don't know, but they got federal dollars to support the teaching program, which means that it's a sliding, always meant, I don't know what it's going to mean now, sliding scale. So it goes from nothing to full price. So that kind of opens up osteopathy and osteopathic treatments.
For treatment or for
treatment.
professional education?
This is a clinic, and they're bringing the residents to their clinic, and the residents are going to be doing, and that's what you get when you go to any other hospital-based clinic. You get the residents, and there's one or two attendings who are supervising them at varying degrees of, time spent and supervision. But yeah, so I thought that was really very interesting and
Well, now it's nurse practitioners.
I'm sorry?
Now it's nurse practitioners and PAs that you see in a lot of these places. You're not really seeing physician per se, but.
Yeah, and of course it's about money. That being said, I was a PA for 3 years to earn money to go to school, medical school, because at that time it was unheard of. This came out of the Vietnam War, actually, where they didn't know what to do with the medics, who were like, PSTD and nuts, so they give them a job to do it. But the training could be very good. And I also worked with a nurse practitioner for 18 years, who I would trust my life with. The problem is the training isn't always uniform, especially in nurse practitioners. But that's a whole other topic. But yeah, and they're doing it. They save money. Julie, my wife, goes to a nurse practitioner. She's absolutely perfect. I have no problem with her. I don't second guess. Absolutely not. Some of them are, I wouldn't, have pruned my tree. So another biggie is homeopathy. So osteopathy, just to give you a sense, the functional medicine is about 10 years old. Osteopathy is over 100 years old. Homeopathy is over 100 years too. And it's based on a principle of like cures like, and less is more, which is counterintuitive to not only medical training that we receive here, but to a lot of things that we think about. And it was always derided by medical providers because they said there's nothing in this stuff. They make these, and you've all seen them, the blue tubes in like Wegmans and the health food store. Boyrin is a main company. Diane Honesdale has actually more interesting ones, the Nature's Grace.
Nature's Grace, he carries a lot, yeah.
Yeah, and he's wonderful. He's a real smart guy. In any case, in the last 10 years, and this homeopathy was first recognized because of the typhus outbreak in a town in Pennsylvania. And there was a hospital, a typhoid rather, I said typhus, typhoid hospital. And there was a hospital where they sent all the ones who were dehydrated. They look like, typhoid is a gastrointestinal, you go into renal failure and you die. There was a hospital where they sent people in this Pennsylvania town that I can't recall, and all Nobody would treat them. Nobody would go near them. But they gave them homeopathy. They gave them home, and the survival rate was something like 25% or something, which doesn't sound like a lot. So it got credence. It started to pick up. People said there's nothing active in it because the stronger homeopathic medicines are, the more they're diluted down. Which again, makes no sense. However, and this is a whole, I could go into how they make them, and it's too long. Now with nanotechnology recognized, we understand that tiny, small particles can be amazingly active for the good and for the bad. Like, if your salmon has it that you eat from the ocean, plastic particles, nanoparticles, not so good. But studies have been done on the homeopathic remedies, and they have activity in the nanoparticle range. Just to put it in perspective for you, it's probably one of the most commonly used medical systems in the world. Asia's big enough. I had a colleague who was moving to France. She was a physician, and she got a job with a big company, a good job. And then they asked her specifically, we're going to have 2 days a week where you do nothing but homeopathy, and then the rest of the time you'll just supplant it, your regular clinic hours. And she said, what's homeopathy? And they said, goodbye, we don't want you, essentially. So homeopathy is used quite a bit in Europe, as are many other things that we don't do. But the good thing about it, the take home is there are probably zero drug-drug interactions. There can be rare side effects if you're not given the right preparation. But it's a valid form of medical treatment, and it's used in the world much more than it is here. And we consider it, nonsense garbage. The other is chiropractic therapy has been in those peer-reviewed journals as being effective for a variety of clinical conditions. Hard to do those studies that are the holy grail for drug trials, like randomized controlled placebo double-blind studies. Hard to do in chiropractic because you kind of know when you get in chiropractic care, right? Just like with acupuncture. But other things that are around that can be quite effective, aromatherapy, the primitive portion of the brain that processes smell is exactly that, primitive. It's like from the dinosaur kind of thing. It's like the amygdala, and can be very, very effective. Probably no side effects. I was in Memorial Sloan Kettering with a relative who was getting chemotherapy, and she got nauseous, and the nurse came up and put an alcohol pad under her nose. And I said, what are you kind of doing? And the nausea stopped. So I learned that trick years ago, and I've certainly used it. It's aromatherapy. It's isopropyl alcohol pads that are in the hospital. The little packets, yeah. Yeah. So, yeah. So
it's alcohol?
Yeah, those, we get them.
Yeah, I know.
Yeah.
We have some.
Isopropyl alcohol. Reflexology is another simple thing that's been around for a while. It's assuming that the hand and the foot are representative of the entire body, and they're not symmetrical, so left and right is a little different. It involves this, We had a big problem that we addressed in the hospital about urinary retention. All hospitals want to do elective surgeries, right? Because that's the cash cow, elective surgery. So get your hip replaced, come to us. So they fired other doctors and hired more surgeons. So anyway, they had a problem with urinary retention post-operatively. And since they want to get you out of the hospital as soon as possible or to a skilled nursing facility, aka nursing home, they want you to pee. You can't go home until you pee. So we got a reflexologist. We did a little protocol on 10 patients. They were all peeing like racehorses, and they hired a reflexologist to work on the post-op patients because it made sense. It's like the military with the acupuncture, but you should know about it. The other big area that is not really integrative medicine per se is and I call it, I made this up, but I call it the neuromodulation therapies. So what does that mean? It includes, I would include deep brain stimulation for Parkinson's, right? So you take a person who has life-altering tremors, you go into the right part of their brain, you give a little stimulation, and they come out and they could, you know, light a candle or do anything with balance incredibly, it's efficacious. It's non-pharmacologic, widely used, and it's something that you should know about. They also have for migraines now, for the first time in 35 years, they came out with a new treatment for migraines, which is an electrical stimulation device that either goes to the trigeminal or the vagus and can have a big impact on migraine therapy. No drugs, nothing invasive. It was costly. I haven't kept up in terms of like to the tune of $150 or something, but it's out there. Kind of like think of it as a TENS unit. Now, a TENS unit is the very first neuromodulator that came out. It worked in some people. It didn't work in a lot of people. It only works on one way to stop the pain. One path in the spinal cord. And if that's the way your pain is being processed, it's very efficacious. If it's not, it doesn't do anything. They have since improved on that. There's an alpha stim, and I could give you the information on this. Over 90 references in peer-reviewed journals. It's called an alpha stim. It's a microcircuitry device. It was developed by a NASA engineer for pain relief. Then they found that the astronauts, it's a little thing, you put the things on your, it's little probes. It's very simple. So it went to space. They then found out that the astronauts that had knee pain or something and got the alpha stim also seemed to have less anxiety and depression. So that he developed a whole other model, a cranial electrical stimulation model, which is the earlobe things. It's been used in neurocognitive disorders, chronic pain syndrome, and in general psychiatry. It has a big literature actually in substance use disorders. It's available, it's referenced, and it's non-pharmacologic.
What's the device called?
I'm sorry?
What's it called? What's the device?
Alpha Stim. I'll bring you the information. I have a whole dossier of them.
Where do you go to get it?
So this one's about, you buy it from the company, and it was about a little less than $2,000. I was able to get one from the company to use in the clinic, and I had heroin addicts coming in. One guy that I always use as an example, he said, "Nina, this fucking shit works." He said, "I can't believe when you came out with that little thing with those stickies, I thought, and this is a guy who's pretty hardcore heroin use. He was actually pretty functional, but his heroin use was heavy daily. And he was able to reduce, and then I use it on a lot of other people who, had other issues, substance abuse issues, but especially for the depression and anxiety and insomnia. It was very, very effective. And they would come into the clinic. We only had one machine. So I was going to give
That sounds very similar, at least consistent with the curriculum, acupuncture points in the ear used in detox.
Except this is
Those used in detox protocols.
Yes, that Lincoln Hospital years ago did that, right? Yeah. But this is a courage, which is not to say that the auricular therapy, the acupuncture, is not generating current either, because it probably does that we can't measure. But this alpha stim, and I'm not an engineer, but they show diagrams of the currents and how it changes. But the CES, the cranial electrical stimulation thing is fascinating. I mean, I'll bring you the stuff. I have the whole packet. And again, something like the seasonal affective disorder light therapy. A little pricey. There was just a study at Cleveland Clinic, I think, that said that the efficacy of the light therapy was much, much greater if you had a shrink on board, if you had a mental health professional on board, as well as using the light therapy, which I hadn't seen before. They used to tell people go out and buy the light and sit under it, but efficacy is improved when you have a therapist who's working with you on it, which makes sense. And also the EMR, and again, this escapes me, I meant to look it up. The eye therapy for PTSD, where they do your eye rotations. EMDR, oh yeah. That's what I was missing, is the D. Can be very effective. So keep that in mind. It's just moving your eyes in certain ways. I saw one example of it done at a conference, but apparently I have a neighbor who did it. Nutrition therapy is real. You know, hardcore allopathic physicians have to agree that nutrition is real. If you eat if you eat a free-range chicken, egg, it's heart healthy because the omega-3, omega-6 ratios are reversed compared to a conventional chicken whose beak's cut off and they're tortured for their 6 weeks of life or whatever it is. Makes a difference. Food makes a difference. Many, many studies have come out that highly processed foods are associated with malignancies, no question, and other inflammatory diseases. And inflammatory is the new black dress in medicine. Everything's caused by inflammation, right? From heart attacks to cancer to everything. And it probably is, to a certain extent, true. So those micro-processed, ultra-processed foods are bad for you, bad for the earth, bad for the planet, bad for everybody. Herbology enjoys some mainstream data as well. The American Neurological Association has feverfew and magnesium on their list of interventions for headaches, for chronic headaches. And there are many, many, many studies. There's a book called The German Monographs. It's about 350 pages. It includes all of the herbal remedies and gives you the references for the efficacy of them. St. John's wort in Europe is the most common antidepressant prescribed. And again, you know, it depends upon how the stuff is processed. These are herbs. They're delicate, how they're picked, how they're processed, what are the excipients in the pills. And again, there's a problem with control, with quality control here, because they're not considered to be anything. I don't know, maybe JFK, that's the one thing.
Oh,
Well, I'm trying to look for the little, you know, whatever. Okay.
something positive.
Nutraceuticals. There are many studies. Am I over? I can stop anytime.
Yeah.
The only other one thing I want to mention is myofascial therapy. The real JFK, the president, used Janet Travell as his personal physician. She canonized myofascial therapy, which is the concept that the fascia is one organ and is an organ, and manipulation of it, much like acupressure and stuff like that, can be very, very, very beneficial, not only for musculoskeletal issues, but for general health issues. So it's just to know about. And
So I want to ask, we are quite over time, but I'm a firm believer in kinesiology. I've gone to a kinesiologist for.
Isn't that amazing?
It is, and I literally don't go to my doctor, a regular doctor, except for basically blood work or very, very few other things.
Good.
I go to my kinesiologist religiously. I've been going to her for almost 40 years.
Where is she?
In Shahola.
That's a schlep.
No.
Oh, it's not.
Minutes. It's right across the bridge from Barryville, literally. Across the bridge.
Oh.
Right
Yeah, right, people like.
Yeah.
Yeah.
Shahola chiropractic. She's a chiropractor as well as a kinesiologist. And I started going to her. My son's 34, and way before, it's almost 40 years I've been going to her.
Yeah.
Since she started in the area, and I'm a firm believer. I've gone to her for so many things that, you know, because it's with kinesiology, everything in your body is related.
Yes.
you know, and
Yeah.
I would have just an example, one time a cousin was at my house and he said, can I help you do something in the house? Can I do something for you? And I said, you know, my desk was a little lopsided. Could you help me put a shim underneath? And he went to lift it and I went down on my knees to put the shim under and I couldn't get up. My knee went out on me. Most people would be in the emergency room,
Right.
this, that, and the other. It was a Saturday morning. It was Thanksgiving weekend. I called her. They got me in a couple hours later. I went in on crutches and I walked out the door.
Yeah.
I swear by this woman. I swear by the kinesiology.
And it's very impressive when they demonstrate the testing, the muscle testing.
Yeah.
With that, I mean, it's kind of like, you know, a dog and pony show. It's so amazing you can't believe it, but it's very effective. I totally left that out.
Yeah.
Yeah. It's good to know that
This has been very interesting. Thank you.
Okay.
Yeah.
Yes, excellent.
Knowledge is power, right? We can all feel better.
What? Right.
They just have power.
So our closing words are: changes abound around us, within us, between us, in our communities, our neighborhoods, and our beloved faith communities. Changes abound. May we each find a balance point we need as we move through our ever-changing world. The balance between old and new, between the known and the unknown, between the familiar and the perhaps bold and risky possibilities that may be there waiting. So we're going to extinguish our chalice. May we use our inner lights and the remembrance of this flame to kindle new sparks throughout our lives and in the world. May the spirit of peace and togetherness bless us all. Blessed be. Well, thank you, Nina. That was very, very, very illustrative.
I'm sorry I went over.
No, you were even
I
a
meant to
doctor.
take my phone.
Well, you know, here's the thing that I just want to mention. Here's it. Can I make a suggestion, please?
Sure.
This clock should be here,
Okay,
so that whoever's the speaker and should be a time.
yeah.
You can talk till this amount of time, 10 after 11, or whatever is a decision, so that the person that's presenting is aware.
Yes, thank you.
Yeah.
I was gonna say, but maybe we should put the clock. Okay, now Heidi, did you want, were you the one who asked me for an alarm clock similar to this one?
Yes.
She did.
Okay, yeah, all right, I have it, so the next time you're here, I can give it to you.
Okay.
Or else I could just put it in a box and mail it to you.
Thank you,
I can do
Steve.
that. I'll do that.
Did you have any questions briefly? Anything you wanted to say? And anybody online? Oh,
Yeah,
Tamara?
Yeah.
I've got a lot to say because I worked in medicine and in research, so I have a lot to say. But I know we're over, so I don't really want to go into that. But I also wanted to say that and I want her to be my doctor, please.
Me too.
Oh my gosh, are you taking new patients? Anyway, but I'm also a Bowen therapist. I'm certified Bowen therapist, and that's BOWEN, and that works a lot with the myofascia things. And I used to be in neurology research, and we have found that the fascia is part of the nervous system.
Oh, yeah.
So it's pretty amazing. And Bowen therapy and myofascia work with the autonomic nervous system. So it's awesome. But yeah, I also studied Parkinson's, and I worked at Emory University and University of Rochester. And there was very interesting things with the pharmaceutical company. Yeah, I got to go to sellout museum shows with tickets from pharmaceutical company that were given to the doctor that I worked for. And It was pretty amazing, but I got to see Matisse stuff, so that was really cool. But he was such a high integrity person. The labs that I worked with, my bosses, both of them were such high integrity that didn't sway them at all the gifts. So I was very, very fortunate, and I think that may not have been the norm. But yeah, so I have some stories. But I just wanted to say that about Bowen therapy, maybe put that on that list too. But this was wonderful, and I'm going to look into the place in Scranton. Thank you so much for that information. And I can say the woman in Shahola is amazing. I have experiences with her as well. She is amazing. Thank you. Thanks for letting me say really quickly that stuff.
I wanted to say something quickly also. For Lorraine in Shahola, that's who you're talking about?
Yeah, Jill stepped out.
Yes. Yeah.
She once presented for the fellowship. I was so impressed with her. She came and actually gave a demonstration and had people laying down on the thing. It was quite great. I just wanted to, there's so many things I could say, but I just want to say that I'm included, but I know of 9 other of my very good friends, not strangers, people that I know personally that I've worked with, have come up with, in their older years, breast cancer. And I always wondered, how could 10 of us, all approximately in the same age range, have done that? And I can only say it could be probably a hormone replacement. I can't understand how it's possible that so many people that I know personally would have come down with breast cancer. We've all survived it, with the exception of one that I don't really think she died of breast cancer. Maybe she just died of something other than that. They didn't just say, but that was one. And the other one was, I think that the doctors, I don't know when they would have the time to research all this. So they get very stuck with what they know and what they do. And I know that when I had my breast cancer, I came up with a pain in my arm, and the doctors said, it's normal. And I said, no, it's not normal. This is something wrong with this. And I went home, and one of my other friends who had breast cancer had sent me the book, Susan Love's book on breast cancer. And they said, it's phlebitis, right in the book. It's phlebitis. And I went back to the doctors and took a copy and showed them. They were astonished. So I'm only assuming that they had told every single woman, that, once they had some of the nodes removed, that it's normal. So I'm just wondering about doctors themselves and how resistant they are to this kind of new information. Because whenever you see them, and you can see their eyes glaze over sometimes when you start mentioning these other things. What is your take on that?
Well, Susan Love was 20 years ago, right? And she was at least a MUD, what I call a MUD. She was at least an MD. So she had a little credibility. But people thought she was nuts then, with all the stuff and empowering women and asking a question to your physician was an affront to some. I could go on about this for quite some time, but you got to be careful with cancer, because everybody's so afraid of cancer that they walk into the doctor's office and say, well, this is what you're going to do. These are the 5 specialists you're going to see, and these are the treatments you're going to have, and you got to do it as soon as possible because blah, blah, blah. And you just got to step back and say, what do I want? What do I want to do?
I have to do a training in a little bit.
All right.
Sharon, were you on hormone replacement?
I was on for a very brief time, and when I went for an examination way before I got the